This is a work that I did with Dr. Bose. We retrospectively looked at all patients who were treated around 4-year time interval, 2017 to 21, who had SF3B1 mutation with myelofibrosis. So these could be patients who presents first time with myelofibrosis to our center or transformed from PV or ET during the period 2017 to 21, or were newly diagnosed at MD Anderson when they had presented with something else. So it was in the range of around 5 to 6% patients who had SF3B1 mutations in the entire cohort of myelofibrosis. We looked at parameters that are different at the time of presentation, their treatment outcomes, and their risks of transformation or progression to acute leukemia. Fortunately, we did not find that SF3B1 has a significant difference. SF3B1 mutated myelofibrosis patients have a significant difference compared to patients who are SF3B1 wild type, both in their baseline symptomatology, the burden of the MP and driver mutations or concurrent mutations, their baseline white blood cell or platelet counts, spleen size, the JAK2 allele burden, etc. The only significant statistically was that more patients with SF3B1 mutations were transfusion dependent and had and less patients with SF3B1 mutation had grade 3 bone marrow fibrosis. Now, the first part of it is plausible because SF3B1 is known to cause more anemia even in myelodysplastic syndrome. But regarding the bone marrow fibrosis, it was a new finding, and I think further studies would be needed to look at that. The responses to therapy, their overall survival were similar across both groups.